It's 2 in the morning. The house is quiet. Everyone is asleep, except for one person. An elderly man or woman is sitting at the edge of the bed, gripping their calf, waiting for a cramp to pass. Their jaw is tight. Their eyes are wet, not from crying, but from the kind of pain that catches you completely off guard in the middle of sleep. If you've seen this in a parent, a grandparent, or maybe even in yourself, you already know how exhausting this is. Not just physically, but emotionally. Because when the nights become battlegrounds, the days become shadows of what they used to be. This is not a rare experience. Medical researchers estimate that nearly 50% of adults over the age of 60 experience some form of nocturnal leg pain, whether it's sudden, vice-like cramps, a restless aching deep in the bones, or that strange crawling discomfort that makes you want to move your legs no matter what time it is. But here's what most people don't know. Nighttime leg pain in the elderly is almost never just one thing. It is a symptom, a signal, and understanding what it's trying to say can genuinely change someone's quality of life. Let's begin with what doctors call nocturnal leg cramps. These are sudden, involuntary contractions, usually in the calf or the foot, that can last anywhere from a few seconds to several agonizing minutes. They are different from general restlessness or chronic pain. They strike without warning. And while the exact cause isn't always obvious, medical experts point to several primary culprits. Dehydration is one of the most underestimated factors in older adults. As we age, our sense of thirst diminishes. The body's internal warning system becomes quieter. So elderly individuals often go hours, sometimes entire days, without drinking enough water, without ever feeling particularly thirsty. And dehydrated muscle tissue is far more prone to sudden, painful contractions. Electrolyte imbalances go hand in hand with this. Magnesium, potassium, and calcium are the minerals that help muscles contract and relax in a synchronized rhythm. When these levels drop, which can happen due to poor diet, certain medications like diuretics, or even prolonged illness, that rhythm breaks down. The muscle fires, but it doesn't release. And that is the cramp. Then there's prolonged sitting or lying in certain positions, something that becomes increasingly common as mobility decreases with age. When circulation slows and muscles stay in a shortened position for hours, they become irritable. They seize. They demand to be noticed. And they always choose the middle of the night to do it. But cramps are only part of the story. There is another kind of nighttime leg pain that is slower, deeper, and in many ways more troubling, and it doesn't announce itself with a sudden grab. It settles in like a heavy fog. Doctors refer to it as peripheral artery disease, or PAD, a condition where the arteries that carry blood to the legs become narrowed due to plaque buildup. During the day, when a person is upright and moving, gravity helps blood reach the legs. But at night, lying flat removes that gravitational assistance. The muscles, starved of adequate blood flow, begin to ache. The pain is often described as a dull, persistent burning, especially in the calves and feet, that only eases when the person hangs their legs over the side of the bed or gets up to walk. That detail, relief when standing or moving, is something medical experts say should never be ignored. It is one of the key clinical signs of vascular involvement, and it warrants a proper evaluation. Because PAD, if left unaddressed, can progress to more serious complications. Then there is peripheral neuropathy, nerve damage that often accompanies diabetes, vitamin B12 deficiency, or simply the natural deterioration that comes with age. The nerves in the legs begin to misfire. They send pain signals when there is no injury. They create sensations of burning, tingling, stabbing, or numbness, often most intense at night when there are fewer distractions to mask them. And perhaps the most widely recognized but least understood condition in this space, restless leg syndrome, or RLS. It is not technically pain in the traditional sense. It is an overwhelming, irresistible urge to move the legs, accompanied by deeply uncomfortable sensations that are nearly impossible to describe to someone who hasn't felt them. People say it feels like something crawling under the skin. Like electricity that won't discharge. Like an itch that lives in the bone. RLS is neurological in origin, and research has linked it to dopamine dysregulation in the brain, as well as iron deficiency, particularly in elderly women. What all of these conditions share is that they are worsened by inactivity and nighttime stillness, and they are all, to varying degrees, treatable. So what do medical experts actually advise? The first thing physicians emphasize is, don't normalize it. There is a deeply ingrained tendency, especially among older generations, to accept pain as an inevitable part of aging. To push through. To not bother the doctor with something that feels like a minor complaint. But nighttime leg pain that is frequent, severe, or disrupting sleep is not minor. It is the body asking for help. The second recommendation is thorough evaluation, because treatment without diagnosis is guesswork. A proper workup for an elderly patient with nighttime leg pain typically involves checking blood levels for magnesium, potassium, calcium, and vitamin D. It includes an assessment of kidney function, thyroid health, and blood sugar, because conditions like diabetes and hypothyroidism are frequent, silent contributors to nerve and muscle dysfunction. These are not exotic or expensive tests. They are standard panels that can reveal years of quiet imbalance that the body has been compensating for, until it simply couldn't anymore. Vascular studies may be ordered if PAD is suspected, including an ankle brachial index test, a simple, painless procedure that compares blood pressure in the ankle to the arm and can reveal circulatory compromise within minutes. No needles. No machines that feel intimidating. Just a blood pressure cuff and a trained pair of hands, and yet the information it provides can be genuinely life-changing. And for RLS, ferritin levels, the stored form of iron in the body, are checked, because studies consistently show that even when standard iron levels appear normal, low ferritin can trigger or worsen restless legs in elderly patients. Supplementing iron under medical supervision has brought significant relief to many who had struggled for years, people who had been told it was anxiety, or old age, or simply something they had to live with. They didn't. And neither does your loved one. Now, what about day-to-day relief? What can families and caregivers actually do tonight, before any appointment is even scheduled? Experts recommend hydration as a first, immediate step. Not just water, but water paired with electrolyte-rich foods, bananas, sweet potatoes, leafy greens, yogurt, nuts. Small, consistent sips throughout the day rather than large amounts at once, which aging kidneys handle less efficiently. Something as simple as placing a glass of water on the nightstand, within easy reach, can begin to shift the pattern. Gentle stretching before bed, particularly of the calf muscles, has strong clinical backing. A simple routine, standing an arm's length from the wall, placing both hands flat against it, stepping one foot back, and holding a gentle calf stretch for 30 seconds on each side. Done nightly, this has been shown in multiple studies to significantly reduce the frequency and severity of nocturnal cramps within weeks. It costs nothing. It takes 3 minutes. And for many elderly individuals, it has quietly restored the ability to sleep through the night for the first time in years. Warm baths or heating pads applied to the legs before sleep increase local circulation, relax muscle fibers, and create a physiological signal to the nervous system that it is safe to release tension. This is not folk wisdom, it is basic thermotherapy with documented benefit. The warmth tells the muscle, you don't have to hold on anymore. Magnesium supplementation, always discussed with a physician first, has emerged as one of the more compelling interventions for cramp-prone elderly individuals. Transdermal magnesium in the form of topical sprays or foot soaks is now being explored as a gentler alternative for those whose digestive systems don't tolerate oral supplements well. The body absorbs it through the skin quietly, steadily, the way good medicine often works best. Footwear matters more than most people realize. Wearing supportive, well-fitted shoes during the day, and even soft, cushioned slippers around the house, reduces the mechanical stress placed on calf and foot muscles. Barefoot walking on hard floors for extended periods is a surprisingly common and overlooked contributor to nighttime cramping in elderly individuals. And for those with RLS, avoiding caffeine, alcohol, and certain antihistamines in the evening, all of which are known to worsen symptoms, can make a meaningful difference even before any medication is considered. That evening cup of tea that feels like comfort. It may be quietly feeding the very restlessness that steals sleep 3 hours later. Sleep position also plays a role that is rarely discussed. Sleeping with the feet pointed downward, a posture that shortens the calf muscles for hours, dramatically increases cramp risk. A simple pillow placed horizontally at the foot of the bed to keep the feet in a neutral, flexed position has helped many patients reduce nighttime episodes without any medication at all. The most powerful thing that any family member can offer someone struggling with this is not a remedy. It is the willingness to take it seriously, to sit with them in that 2 a.m. moment and say, "This matters, you matter, and we are going to figure this out together." To not brush it off as something that simply comes with age. To make the appointment. To ask the doctor the questions that the patient is too tired, or too used to being dismissed, to ask themselves. Because no one should have to fight pain alone in the dark. And with the right knowledge, the right support, and the right medical guidance, they don't have to. If this helped even one person sleep a little easier tonight, please like and share it. Someone you know may need this more than you realize. Drop a comment below and tell us your experience. Your words might be the reason someone finally gets the help they deserve.